Double check. It's like, good afternoon. Today is December 9th, Friday. This is our UMACO TV weekly event for healthcare updates. We are going to cover COVID updates, COVID vaccine updates, monkeypox, as well as we are going to discuss the global events and the U.S. economics. So I am going to bring Sean Dunnigan. All right.
All right, I'm in.
Hey, Sean, how are you doing?
I'm doing good. Good to be back. Got a couple weeks off.
Right, it's been a while.
Yes.
So good to have you. Now we are gonna get our COVID updates. While you start with that, I'll bring the video up.
Sure. So at the beginning of this COVID update that you're going to get loaded up there, I'm just going to start with a shout out for this being December now. It's our first session in December. December is our HIV and AIDS awareness month. So I just wanted to have a little shout out there for that being the month of December. And then we also have a couple of cartoons of the week. So since we had a little break since our previous session, we do have a few different cartoons here. So there's 3 that we're going to discuss real quick. Our first one here is the holiday tree. We have Christmas tree with the ornaments, and on it we have it's actually RSV, the flu, and COVID. So that's what people are getting, as their gift this season. We know it's going around. Everyone's kind of catching something of some sort.
So in case they don't catch it out in public, so they will get it from the Christmas tree.
If they're getting close to it, if they're decorating it with the flu, if they're coughing on their trees or putting it up, very likely, yes. Our second one we had there was actually with China regarding their COVID protests. And it was kind of just the vaccination, how they're saying there's no vaccination on freedom. So with all their protests going on, we're actually going to touch on that a little bit later and getting. Okay, I think they should be able to hear me now because I was muted. So since it was picking up from your mic before.
Oh yeah.
So now, okay. So what we're gonna do is we're gonna give a COVID update really quick as we try to get the internet back and reloaded.
Oh, okay. So I don't know if John Donnelly is watching. I know he usually does, but we are having these issues with the connection. It's not the first time. And I think he's in a meeting.
Yeah, he may not be tuned in for this particular session right now. But I believe it's going to pick up your audio now.
Yep, it should.
So, okay, it looks like you're back.
All right, let's try it. Let's try this again.
Sure.
See, this is what happens when you don't do that every week. Even the connections are not
A little
working.
rusty right here. Okay, it looks like we're good now. Just got a text. So the three political cartoons we had there were relating to COVID. As you're saying, we're going to touch on the ones relating to China and their protests a little bit later in more detail. Just going over the numbers though, we did have the plateaus we saw a little while ago. Again, it has been a couple of weeks, so these numbers will have a little bit more drastic of a change since we last saw them. It's been a few weeks since our last session. But overall, one of the things I do want to point out on these, we always give the monkeypox update. And looking at that graph on from the CDC here, it has literally dropped all the way down to maybe like 1 or 2 cases for like on the daily average. It had that big spike back in summer in August, and then since then it was just a steady right on down, and it looks like it's, like I said, maybe a few cases a day, if that. And that total number actually for the US cases never even broke 30,000. So
I do want to share my screen very quickly with the hospitalization. So hopefully people are understanding what we are sharing here. So this is from our provider meetings. Every week, Thursday night, we update our providers from the United Medical ACO network numbers. So these numbers are not given to us by anyone. These are our own numbers.
right.
So I'm going to actually share my screen. So what I want people to understand is, all right, let's see here. Okay, so I'm hoping that everyone can see this. So, and we are going to use the drawing option here. So this is November. So I'm going to need Sean to do it for me.
2,479.
So that's
2,479.
2,479. Okay, almost 2,500. So am I in November here?
Yeah, November of 21, and it was just over 1,800. Looks like 1,875.
So then we have about 680 more. Now, what I want our people to understand is this is the hospitalization. So this admission means people who are hospitalized during the time of November 2021 and the November 2022. Now, this is from the same population, same group of people. So this is from our ACO, Accountable Care Organization numbers. So we went up from here to here. That's 680 more. So then I know one of us will be able to divide 680 by 1,800. So that's 33%, a little bit more than 33%, right?
1,800, like 37.
37. So
quick mental math.
So this is a 37% increase in hospitalization. So now, I believe when I discussed it with John last time, I made the same point. So if people don't follow the media, news, and others, so this is a healthcare institution number. So this is from our organization. This is from out of maybe 70,000 patients that we have actively seeing, but total of 115. But this is on the value-based contract. So this is the number of people who are more to go to the hospital, 37% more. That's a lot of numbers, I mean, a lot of increase.
Yeah, I would agree.
So now, hopefully, if you don't, and you shouldn't trust maybe Fauci much, but you should trust our numbers. So when these numbers are 37% higher than what it was, then you don't need CNN or Fox News to tell you what to do. So clearly, we are going into a season, the flu and the winter season being just difficult anyway. So these numbers are going to be up. People should be taking care of themselves. Like I was at an event last night, and it was almost like a super spreader event.
Mm-hmm.
Now, one of my physicians was going to come with me. I'm so glad he didn't, because I didn't want him to be in that room.
Right.
Even without the COVID, that room wasn't healthy for anyone.
Mm-hmm.
So it was a, well, the room size-wise, it wasn't small, but there were way too many people in one room.
Yeah.
Almost 250, 300 people. Maybe there should be only 100 people in that setting. So take care of what you need to in winter. So if you are over 65, the mask is something that you should be using every day. So it shouldn't be something that you are, when I say every day, when you go into public, it's a preventive precautions that you can take. So
Mm-hmm.
anything we are going to say, or anything that we are going to, any debate that we are going to go in, who's right, who's wrong, we know the numbers. The numbers are right now, flu, COVID, all the other stuff are happening out there. So, and if the winter is the way it is, these numbers are going to be high. Now, we are in December, and I'm not really looking forward to present the December hospitalization numbers. I know it's going to be higher, much higher. So let's make sure that we prepare ourselves for what's coming. So winter is not coming, winter is here. So hopefully our patients can listen and understand what we are trying to tell them.
Yeah, I would agree. Yeah, as you're saying, it's just that one extra step of preventative, caution where, it can't hurt. If anything, it's only going to benefit you. So if you know you're going to a crowded place, or maybe you're feeling under the weather yourself, might as well wear a mask or stay home.
If you have, if you have, again, if you have risk factors, right? So what are the risk factors? Someone with diabetes, someone with hypertension, someone with morbid obesity, someone with heart problems, chronic kidney problems. These patients are more vulnerable when, like if you have COVID, you are not going to be, if you have the flu, it's not going to impact you the way that it's going to impact someone who's 75 years old with three of these problems together.
Yeah.
So fragile. Like the case conference that we do every morning, right? So we haven't seen, or we don't see much, the patient is only with hypertension. Usually it's a combo. It's like a McDonald's style. So you get a meal of the hypertension, you get the kidney problems, you get the diabetes, and then 70% of the time they come together.
Yeah.
So if you have these risk factors, so you have to be more careful, and that's all we are trying to say. I'm not actually trying to scare anyone in any way. So now, anything that we missed there?
No, I mean, like I said, just to remind everyone, those numbers, it may be a little bit different since we had that little bit of a break. But overall, like you're saying, going into the winter, we're in almost the middle of December now. So December, January, winter months, you could be more vulnerable. People are cooped up in the houses more, less fresh air circulation, that type of stuff. So this is all just going to come into factor. So we've been saying the same stuff.
Absolutely. Now, do you want me to do the China COVID part now, or?
I mean, you can. So we had the one video kind of showing protests that were happening in China. We have that, or the other global event videos kind of has other things.
This the one with the protests happening in China now. Why this is important for us? Because it's kind of like related to the COVID discussion. So, and again, this is just a personal opinion at this point. So, when COVID started, it was the end of 2019. We started getting the news from China.
Right.
In January 2020, I was actually in Turkey. And my brother-in-law, he was asking me if we should really be worried about this. Now, this is January 2020. Okay, so no one knew what was happening. And I said, look, I mean, every year we have like 40 to 80,000 people die from COVID, from flu.
Yeah.
So this is something probably similar. So it's not that important, this and that, right? And it escalated very quickly in a couple of months. And then China stopped reporting their numbers, and the rest of the world, we had so many people got infected, they lost their lives, they got sick. I was one of the first COVID people in Delaware, end of March, early April. So, but that time, since then, we got the vaccine, we got the boosters. So, and all of a sudden, China we start getting these videos. First, I thought they were fake. And I don't retweet until I check in a couple of different sources. And then all of a sudden, we realize that these are real. Now, there's this zero tolerance policy, which is pretty extreme. But why are they so worried about this at this point is kind of a concern of mine. So, and I share this with our providers, and I do want to share with public. So there may be something coming to our way. So we have to be watching and following these things very closely to make sure that we are not getting hit by some unexpected wave of COVID. So I'm just worried about that. So these videos are real, and hopefully we don't get caught by some unexpected surprise.
Yeah, like you're saying that it's just, if you're paying attention to the detail, I could see if this was happening initially back in 2020, they had no idea what they're dealing with. You know, let's go 0 to 100 full on. Let's, you know, taking no chances. But as you're saying, it's been, you know, over 2 years now, almost 3, and the fact that this level of, I guess, severity that they're taking with these precautions, whether, you know, they were literally gathering people up and taking them if they're disobeying certain laws and policies that are put into effect regarding that zero COVID tolerance. So that's why the people are protesting, trying to fight back against it. But as you know, they have a different government set up over there in China. So kind of hard for people to do that. So,
well, I mean, if they feel this strongly about it, you know, I don't want to just blame the government, but I'm just worried that they may know something that others don't.
Yeah. Especially as you know, as we know, they didn't report the numbers the first time around. Why would they voluntarily tell us, you know, what's happening the second time? So definitely something to pay attention to, and we'll see what's happening next few months or so.
Now, we'll go to the global events from here.
Yeah, so the global does have a little bit of overlap. I think it starts off with, again, talking about government, actually what happened in Germany. There's a group of about 25 people or so, I believe, that were actually just recently, as a coup they had, trying to overthrow the government. I think there's like a planned assassination they were trying to do.
So I'm so glad these things are happening around the world anymore. So someone being from Turkey, we had this, well, actually, I'm really not glad, but I'm kind of like maybe. So we had these things always happening, and then we were always thinking that in like US, Germany, England, these things wouldn't happen. Now we saw what happened in 2020, 2021, January here in US. Now Germany has, like, this is very unthinkable, right? So for Germans to think that they would take over their government, take down their government at this point. So it's now this is what they have given us. This is what we were informed, but we don't know the background of it. But apparently some royalists or royal family is trying to overthrow the
as I said, there's
so now these things are happening everywhere in the world, so not only in Turkey.
But yeah, so we did just want to touch on that. Again, like we said, we had covered some of the protests going on in other countries. As you were saying, some of those, it was like the unrest and instability, unstable conditions, I should say, in not third world countries, but countries
you can say that.
To a degree.
Less developed.
Less developed parts of the world where we would see kind of these conflicts of different regimes trying to
remember,
take
this
power.
is my home, like, so if you were thinking that I was going to be upset with the third world, so it's like you and I, we are same age here in this country, 24 years.
Okay. So. Exactly. So here, like, actually, the next video we have playing right now is actually showing you the gangs, the gang violence in Haiti, and how they're actually just like, I guess, kidnapping people, holding them for ransom. It's like a territorial thing too, as we know, it's common with gangs and their territory type thing. But the main thing here is the fact there's a lack of control, government order going on here. So it's a different type of unrest, but again, a common
But I
theme.
think though someone is stirring up the pot, right? So this is the reason we are actually showing these from different part of the world is there is a very kind of like similar pattern with these regions, these countries. So then what we see is we're familiar with these from different places already, and we don't want this to turn into some crazy war, which we are already there.
There is.
So it's almost the anniversary of the Ukraine-Russia war, and when it started, we didn't think it was going to be this long, right? So it was going to be a couple of weeks, and it shouldn't happen, but in a couple of weeks it was going to be over, and it's not. So it got bigger than what it is. Different regions are having similar issues, and we just don't want these to come to our way here.
Yeah, I agree. Yeah, so this unrest, as we said, a lot of people not necessarily blame the pandemic, but having that halt on our global economy and everything else, and now you're seeing this ripple effect, in a few years right after. Sure, it has some sort of impact on what's going on here in this change of power. We're kind of seeing the attempts across the world, different spots.
Now, one of the maybe from the global event side, one of the really scary part is the nuclear war, right?
Yeah,
so
Russia,
now this doesn't seem like it's too far anymore. So it's actually getting closer, and that's something that we are going to be following very closely. Not like anything that we can do about it, but
if something did happen, I'm sure you may hear about it prior to us on that Friday of that particular week. So
well, hopefully not.
Hopefully it doesn't happen. So hopefully you're there in the following.
Promising.
I'm just saying, realistically though, but ideally you want us to keep giving you an update each Friday, and that it hasn't happened, and that.
So, the way that I see or I process this is now it's almost like now it becomes maybe closed reality, like for something that we didn't think of. So now knowing that this is a possibility, then we probably need to look into what maybe just for average citizen. Should we prepare in a way that like at home you have certain things and sort of like certain goods and the things that you may need for immediate kind of like a first aid or first reaction. I mean, I think people should think about those.
Yeah, it's always good to have your emergency kits prepared regardless of whatever it happens to be. If you're in a snowstorm or a thunderstorm, you lose power for a week or something, but this is just now another potential emergency that could happen where, like you're saying, just it can't hurt to be prepared.
No.
So
yeah, definitely. So now, what else do we have from the global side?
Well, at the beginning a little bit, I think we already may have passed it in the rotation, but coming up here, we did have slides on, speaking of Russia, the trade that happened with Brittany Griner, and then the arms dealer that happened just the other day.
So now the Snap CEO is on the global one, or
Snap CEO is right here in the global one.
So why are they still talking about people working from home, and then he's trying to get them 80% of the time in the office?
Trying to get down to, well, I know they also said in the UK they're trying to cut to the 4-day work week. But I know that we had our own discussion, I think earlier in the week, either this week or maybe it was the end of last week, just on productivity and I guess kind of like your environment and how that's going to play impact on like your work ethic, and maybe certain things where you might slack off more so at home if there's no one to actually hold you accountable, if you're not, in an environment where you have other people being productive around you, or you might be distracted.
So I think the issue is that we have employees, and if you look at United Medical as a group, so United Medical has the clinics where patient care is provided, and then we have business office. So, and then we have a surgery center. We have a surgical practice. So some jobs you cannot really do it from home. So, and then some you can if there is a need for it. But if it becomes a permanent alternative, I think there's a huge problem with that.
Yeah.
I do 3 meetings before I get to the business office, and with the setup and everything, I have a proper setup at home. It's not the same. If I didn't have like a set meetings, I wouldn't want to just spend 3 hours. The things that I'm doing here in my office in 3 hours versus if not like a setup meeting, so that you just have to kind of work on your own.
Yeah.
That's not the same. So anyone who's really claiming otherwise, they are delusional, because again, it's a good alternative when it's needed. Temporary cases, fine, but if it becomes a permanent, so we're reading this and it's like this is Snapchat, right?
Yep.
The CEO is Spiegel. So he's trying to get his employees back. Well, it's almost 3 years now.
Yeah, I was gonna say a similar thing actually happened, if you remember, with
They're
Elon.
snapping probably at home, so
distracted on the app.
right.
But yeah, no, the similar thing happened with Elon with Tesla and then Twitter too. Are you saying to get their employees back in the office, or if not, they'd be let go?
There's no way, like I can argue and take this debate with anyone. When you compare the productivity and efficiency, no way. So someone in different levels, things can be done, and then you again, if there's a need, like the reason we start is because we have the time zone difference,
right.
So then we start really early. So then otherwise I'd rather be in the office. So even like a puppy or a dog can be a distraction, which it is. This every morning, right? So if you have kids and if you have your husband walking around, your wife walking around, your partner, whoever you have, and then it's not the same. I mean, it's not going to be the same. So I think they are in.
Yeah, I don't think that's going to be his attempt. Looks like he's having like an attempted, I guess maybe a trial or so to starting.
So he can call me and I'll tell him what to do.
Yeah.
So, if he needs to. It seems like they're Snapchatting a lot, like so. Which this is one of the things that I never got into.
It's not too late.
I just passed that age cut, so. All right, so should we go into the US?
On the US one, we had a few different things. There's not a main theme we have, but there's just various different topics, like I said. So we did have kind of a tech war going on. This is not necessarily outdated, but from about a week ago or so, it was more current in the news. But going on with Elon talking about how Apple is trying to yank Twitter from the App Store with that debate going on. So, there's the whole freedom of speech associated with the app, how they were banning certain accounts. They're saying who can say what. And
so since you and I are from different generations, so what's the freedom of speech to you? Like, what does it mean?
Well, I mean, you're
just putting you on the spot.
I am. I mean, your generic term. I think it's not necessarily when people hear that, maybe they think of actually like what they're actually saying or putting into words on the internet. But also, there's like being able to have your own beliefs and stand by them and not say you're like, in my opinion, I think if someone is, trying to go against your freedom of speech, it's also saying you can't believe in this or this is not allowed. Like you can't think this way, and that's.
So I'll put it in perspective. So like we just find out that Twitter actually filtered Biden news in 2020, 2021, before and after the election. So, and this is done by a very liberal media. There's a study that Twitter employees, 99%, they vote Democrat. So there's nothing wrong, but 99% is wrong. So if there's one company that, I mean, it would be wrong other way around too. No one should be 99%. It should kind of reflect what the country is. So we should be able to live with our differences and accept our differences and live with that. So 99% will make you radical, almost like you'll become like an Al Qaeda or ISIS type of people, and then you'll start killing people, and it doesn't matter which side you're on.
Yeah.
So there should be a balance, right? But then why would I not be able to get this news if this is important? Is a big issue on the freedom of speech, right? So Elon Musk probably is it's going to be one of those people who may have similar path to Trump. So you may not remember, but Trump used to be a TV star in 2006, 2007, when The Apprentice was a really big show. Democrats loved him. There were no problems. And all of a sudden, he ran for the other side, then he became the worst person in the world. But he wasn't like that.
Right.
I mean, all the TV shows, they hosted him, they wanted him, everyone wanted to be with him, blah, blah, blah. Yeah. Clintons, they were very close to him. And all of a sudden, he ran for Republicans, and then he became the worst person in the world. So Elon actually has a similar path, like, at least that's what I'm seeing. So everyone was loving him, and then Democrats were loving him more than probably Republicans because of Tesla being electric and green, which, the electric cars, they have their own issues, right? So they're not that green. Yeah. We just don't see it. So it's like
they're getting that fuel somehow.
As we don't see it, so then it's as long as it's not polluting where you live, so it's okay to dump the shit in other places. Exactly. So, but that's the reality. But anyway, so that was kind of like, oh, green and this and that, and that's the great. And all of a sudden now he's saying that, look, you shouldn't be filtering. No one should be filtering. If it's real, if it's news, then you should not be filtering this. You don't get to do that. So if Twitter, Facebook, these are kind of utility companies anymore. So you can't just push one opinion, or you can just censor one idea over the other one. So just because he's bringing these things up, all of a sudden he's not so great anymore. And I do feel kind of sorry for him, but I think he's gonna turn Twitter around, and it will become a safer and better place. Twitter lost when they blocked Trump. That was the worst mistake that they could ever have done. Because when you feel like because remember, when Trump was a president, so he wasn't a Republican president, he was the president of this country. So you, as a company like Twitter, so you feel like you are better than the head of this country, you're disrespecting everyone. So like, you may like our president today, or you may like him or you may not like him, doesn't matter, he's the president. So if we undermine that position, then you are disrespecting the system and the people of this country. So that's what Twitter did.
Yeah, they're trying to supersede.
Right. So and they paid their I guess dues. This was a big
and as you're saying though, one of the things you said a little bit earlier, but how you're saying where it's kind of dangerous if everyone is thinking one way, as you're saying, like the 99%, and especially like platforms, Twitter, it's such a big reach on, I feel like it's some like even the celebrities where, maybe an athlete, they have, 150 million followers. So like if they say something, potentially at least 150 million people, if not anyone else on the Explore page, or they are getting access to that information. So like you're saying, for a company or a platform to kind of just maybe overstep their bounds and saying, well, people actually can't listen to what this person wants to say anymore, just because we don't necessarily agree with them either. And I think, like you're saying, that's where it's for the platform, and it's a freedom of speech. It's regardless. Maybe you don't agree with them. Maybe it's not factual and it's incorrect information. That's for the the viewer, like you're saying, we do our research too before we then go and say, oh, did you hear XYZ? You have to do your own due diligence on certain things. So I think, as you're saying, it was kind of a big mistake that they made, and now it's, Elon's kind of taken over, seeing what we're
we like him, so I think he's a good guy. He may be a little bit crazy, but it's okay. I mean, if you are at the level of his in terms of being a genius, so then you can be a little bit crazy. That's fine.
If you're normal, it'd be alarming,
right? So I lost the $100 bill to Anthony Anubu.
You did.
I did give him his $100 yesterday. If he's watching, he can attest. Walker, Warnock, right?
Yeah.
So 51.4. This is Georgia.
Yeah. So Herschel Walker was the one who actually lost.
But something else happened though. Like Arizona Democrat. I can't remember her name, but I'll check it. She's now registered as independent. This is just
something just happened the last day or two.
Not
right?
Today. I think I just wrote today. If one of my people are watching it, so they can maybe text me. But I just saw that, and I should have tweeted that. Maybe I did. Let's see. So the first tweet is getting $20. So Arizona Democrats, okay, here. Kristen Sinema, switching from Democrat to Independent. So that's just 8 hours ago.
Yep. That's
interesting. That actually changes. That almost, in a way, it's reversing what happens.
I wonder how.
It's
I wonder if there's like any like regulations on it. Like, could somebody just go run as Democrat, and then once they win, say, all right, I'm actually a Republican? Like, there must be some laws, regulations.
I don't know. I know in different countries it's allowed. But if it wasn't allowed, she wouldn't be able to do it. But I think maybe what you're asking is whether or not what she did is right. So so when we are so this is a good maybe point of what are we voting for? Are we just voting just because we are Democrat? So then you bring the water bottle. Just because they say they're going to vote for this, or we are voting for the person.
The person, how they think and evaluate. Yeah.
So if that person is, if the answer is the person, then you should be able to
switch. Can change their mind.
But I mean, it's not an easy decision for her. What I was thinking that she may be doing it, and since no one is watching us, so then we won't get in trouble. But I think she did it because now she becomes a deal breaker for many of the votes. She becomes the most important person in the Senate. Yeah. Remember, there's only 100 of them. Yeah. So and now they're equal. Yeah, so then she's saying that, well, I'm independent. So because it's a big decision.
Yeah. So now then if think
about it, so they have to suck up.
Maybe she'll get some nice dinners.
She's smart in a bad way. So you didn't think about that, right?
Oh, that's a good point.
So now the other thing that was a concern, this 65-year, like sometimes I don't know why I get these news.
It's a good read.
Part of it is because when we are preparing for these events, I think the AI picks up these and then just say, oh, here's some recommended news that you should be reading. 65-year-old recently met a gorgeous 70-year-old millionaire who started acting as a financial advisor, but he posted it and left her with $20 in her account. So I'm actually reading her statement.
Yeah, she can bet you on one topic.
Now this is a real issue, and because we do this for our patients as well. So I'm hoping that maybe we are reaching out to those patients with Medicare. They should really watch out what they do with their finances. Other than the professionals, they shouldn't be trusting newcomers to their whole life, because again, you don't know these people. They just get into your life, and then all of a sudden you are going to give them, or sometimes they call and then they say, well, do this, or give me this information. Like, be very careful, right?
So if you see a gorgeous 70-year-old out there,
I mean, what's gorgeous 70 years old anyway? So, anything on this one?
I mean, well, past sessions, again, we've always talked about how the finances and, you want to prepare, like you said, when everyone even got the $1,200 stimulus check, and it was, did they spend it on wants or needs? Did they save? Did they invest it? Did they make it an emergency fund? And, I think the one study showed that the majority of people went and bought like luxury, not luxury item, but like non-essentials with that money. So just that same similar theme where when it comes to the finances, people don't realize, I know we even talk about even medication costs too, that how these impacts, how finances and managing that actually have a big impact on your health and overall, obviously, lifestyle. So I would say definitely be careful who you're trusting, and like you're saying.
Well, don't trust people, or trust and verify, but don't just give everything away, even if if they become your life partners in late,
Still,
like the 70
be better
years.
to have separate. Yeah,
You
can have some joint.
Gorgeous 70 years old, and with the gorgeous 65-year-old, please be careful and then don't lose everything. Well, so we have our bariatric Friday coming up with Dr. Erkan. We are going to discuss the holiday, going through the holiday season without gaining 20, 30, 40 pounds. So far, I'm doing good this year. But I do want to share something. Let's see if this comes up. This is our new office, United Medical Clinic in downtown Wilmington. Well, the picture is kind of like cut off because of the video setting. We start seeing patients there now. We used to be on Gilpin Avenue, and now we are. Let me see if I can find a better picture. It's a really nice location. So I think our patients will like it. So let's see if this picture is any better. Maybe no. So these are, don't look at these.
All right, there we go.
Hey, the sign was right above me, so that's why I have that.
Right. It is actually a really great location, like you said. I've seen it, and being centrally located right there, a lot of foot traffic too, and easily accessible for people in the area.
Right.
So
let me see if I
upgrade,
can find. There is. I'm going to try one more, and then if it doesn't work, then maybe next week we can share some of them.
Yeah, we can actually make a little intro.
Oh, there's Alp. That's United Medical Clinic. This is 600 Delaware Avenue. So we have our bariatrician, Dr. Van Singh, who is there Monday through Friday. We'll have a second provider who's going to be there from the primary care side. Kidney Care Association is there, Doctors Dhruv and Rama Patel. And I believe Delaware Cardiovascular is going to be there for 1 or 2 days. It's going to be a nice central location, and United Medical will have a business office extension on the second floor. So we were there last night, and it's looking good. So, all right. Next week we're on. I'll be back in 10 minutes with Dr. Erkan. And until then, please stay safe and have a wonderful weekend.